I had a wonderful discussion with Christie Amorosino of Quincy College. Let's take a look. I'm so pleased to welcome Christie Amorosino, who is the chair of the Physical Therapist Assistant Program at Quincy College. Welcome.
Thank you.
So good to have you here today.
Thank you. I'm happy to be here.
Quincy College is a wonderful local university that we have here. What brought you to Quincy? Let's a little bit about your background personally.
Okay. So I've been a practicing physical therapist for over 25 years, and I have taught at the university level for many years intermittently throughout my career, which I have enjoyed and just sort of have a passion for teaching. And I recently finished getting my doctorate in 2021. And so I knew that was going to lead me closer to academia and trying to obtain a job in the academic world. And so this position became available, and someone on the faculty thought it would be a good fit for me and wanted, to try to collaborate and work together. And so I applied for the job, and
the
got
rest
the
is
job.
history,
Exactly.
as they say. Okay, wonderful. Now, when people think of physical therapists and physical therapist assistants, I think a lot of people probably don't know the difference. So can you just educate us, what's a PT and what's a PTA?
Sure. So a physical therapist is basically, in order to become a physical therapist, most of the programs now are doctorate programs.
Okay.
So it's a 7-year commitment, 4 years of undergrad and 3 years of doctorate work and clinical experiences and rotations and things like that. PTA is a 2-year associate's degree. So the difference between the education and then the outcome is physical therapists are responsible for evaluating patients and designing a treatment plan.
Okay.
Physical therapist assistants are responsible for implementing that treatment plan. So that's the main difference.
Okay.
But physical therapist assistants are also trained to monitor patients' progress, so they're still able to, and they're responsible for giving the physical therapist feedback about their patients so that we know they're making progress, and if we have to change the plan of care, the physical therapist would do that.
Okay.
Yeah.
So to the person who's using the services of a PT or a PTA, as long as we're making progress, we're happy.
Absolutely.
Right.
Yeah.
So, one way or the other, right.
And I work with physical therapist assistants, and oftentimes patients will come back and say, I want to see so and so
again. Right. I really love working with so and so.
Yeah, it's such a nice feeling that you work as a team, and patients. I don't want to say they don't know the difference, but because they see the PT to, for that evaluation and whatnot, but ultimately they get better, and the treatment plan kind of goes seamlessly usually.
Exactly,
Yeah.
exactly. So the PTA program is obviously much, much smaller, shorter, less expensive, takes less time to get through. So for some people, I would assume that works really well. People that want to go into some part of the medical field.
Correct.
What types of places would a PTA work?
Right.
What are all the different environments I might work in if I was a PTA?
Right. So lots of variety. So outpatient clinics, or, that would be in orthopedics or neurology, pediatrics. Inpatient, which would be hospital settings, rehab settings. Oftentimes there might be a clinic or a facility in a fitness facility or gym, sports teams, home care. You can work for a home care agency, a visiting nurse, association, something like that.
Which often happens after any kind of surgery where you really can't drive or you're not supposed to go anywhere. You have someone come to your home for a while until you're to the point where you're mobile enough to go outside the house.
Exactly.
Yeah. So there's a lot of flexibility as far as where you might work and even the hours you might work.
Yes,
right.
Definitely.
I would assume if you're a 2-family household and you have children and you want to work around everybody else's schedules, there's probably a shift somewhere that would work for you.
Yes, definitely. Especially right now, I think that the demand is very high. So places are likely to, willing to work with you on your hours and what you might be able to do. Yeah.
Yeah, because the healthcare
definitely.
in general is quite a shortage
Yes.
of people,
Yes.
of professionals. Now, let's talk about the type of person who would want to be a PTA.
Right. So I think the main take-home message is that you want to work with people. You want to help people. You want to see people get better and make progress and have an impact on their lifestyle and their well-being. You have to put your hands on people. So we always kind of say, students who are in the sciences and not sure what profession they might want to go in, if they're looking at PTA, we make sure that they want to, or they know that they're going to be with people, hands-on treatment.
Right.
So that's one criteria, one of the main things that we try to drive home.
And I think people aren't always at their best because oftentimes they are in pain when you start. But it must be very rewarding to be able to follow a patient all the way through and see that progress being made. That must be wonderful.
It is, and I think speaking as a physical therapist, when I was thinking about what I wanted to do with my career, I knew I wanted to do something in medicine or in the medical field. I had physical therapy, and I thought my physical therapist was really cool, and she spent a lot of time with me, and I realized that physical therapists spend a lot more contact hours with patients versus, medical doctors or whatever, and you can see that progress, and I think a lot of times people who become PTs or PTAs have had physical therapy themselves, so they kind of understand.
Yeah, the value of it.
Exactly.
Now, the program itself, if I was to sign up for your program, become a PTA, I saw a video on your website, which was fascinating to watch, that you have this fake person with all these fake muscles. And tell me about the whole process of how people learn.
Okay, so that is called a syndaver. So in most all physical therapy programs, and I can't speak for all PTA programs, but we learn the human anatomy on a cadaver. So we have a lab where we go in and we, take apart and try to identify all the muscles and body parts. This is that, but it's synthetic.
Right.
So it's made up of.
It's not a real dead body.
It's not a real dead body, and but it has all the muscles and bones and joints and origins and insertions of everything.
Right.
So it's a way that students can learn in a sort of a 3D tactile way.
What really is inside all this.
And that's unique to Quincy College. That's not. It's sort of a.
It's unusual. You wouldn't find that in most places.
Correct.
Oh, wow, that's excellent.
Yeah,
that's excellent. And how many students do you enroll at any one time, or is it rolling admission into this program?
It is not rolling admission. We take 12 students every fall.
Okay.
So and that is based on our accreditation through our governing body, basically, that we're allowed to take 12. So 24 total at one time. So that it's the 2-year program.
And can people do it part-time? Like if you have a semi full-time or a sort of no, you need to do this full-time.
It's pretty much full-time.
Okay.
We do request that people are available Monday through Friday from 9 to 3 or 8 to 4, like something in that vicinity. So they are able to work part-time in the evenings, perhaps, or on the weekends, but there's also a lot of assignments and work, homework and things like that. So people they do work part-time, but it's a pretty rigorous program.
And do you find that this is a program that attracts people right out of high school versus older people, older meaning, from 30 and above, who kind of are looking for something else to do?
That's a great question. It's definitely a mix. I would say more often than not, they are not right out of high school. A lot of our students actually have bachelor's degrees in something that would, be a sort of a lead-in or nice fit for the physical therapy profession. But they don't have a specific profession attached to it, let's say. So a lot of them do have bachelor's. We do have some right from high school, and then we have some looking for career change later on. So the average age, I'd say, is closer to 30 or some, thereabouts.
Enters this program.
Yeah. Little
and then
later on.
I assume, like with nursing or most things in the medical profession, you have to kind of have continuing education or just keep up with the latest trends, the latest
Yes.
educational components
Yeah.
that come along with it.
Yes, I mean, you get what you get in school, but there's a lot of niche practices out there as
Sure.
well. So there might be other avenues that clinicians want to take, and there's continuing education for that.
Right.
For those specialty areas, which
Yep.
PTAs can partake in, and or just your, just the general upkeep of your skills and staying evidence-based and current in the field.
Right.
There's lots of options for continuing ed. So everyone's encouraged to do that. PTs, PTAs.
Right,
Yeah.
right.
Mm-hmm.
So it's a broad field. It's a very flexible field.
Mm-hmm.
It can be constantly moving and changing, as I'm
Yes.
sure it is.
It
I mean,
is.
I know just knee replacements. I had my knee replaced in 2019,
Mm-hmm.
and they wouldn't have done the same thing now that they did just
Yes.
3 years ago.
Yep. The
It's-
technology is.
It's all different, and I assume then the PT is different around whatever they do to your knee or whatever
Yes.
is done.
Yeah, I mean, there's research being done all the time,
Right.
and it's sort of our, our responsibility to read that research and keep
Keep up with
current
it.
with the
Yep.
journal articles,
Yep.
and that's sort of something I'm teaching the students,
Yeah.
all along. They have to, have that responsibility to not just show up and
Right,
do what they
right.
do. It has to be the most current.
Keep current, yep, keep in the present. Okay, so it's a 5-semester program, so it's
Yes.
2.5 years about?
It's almost closer to 2 years.
Okay.
That 5th semester is a 5-week clinical experience that some of our students are on right now. So
Okay.
it's a sort of that first summer session, if
Yep.
you will. So basically, it's 2 years of school,
Yeah, and then ready to go.
and then they have to pass the licensure
A
exam.
test, of course,
Yeah.
of course. And do you help them with placement?
For job placement, anyone that would need it, sure, yeah, we
I
can
assume
use
there's-
any connections that we
There's
have.
probably a
and
lot of jobs out there.
but there's
Yeah.
a lot of jobs, and sometimes they have jobs already lined up because they've been working as an aide in a clinic or
Gotcha.
something like that, so they've already made their
That's
connections,
wonderful.
or through their clinical experiences if they've,
Okay.
yeah.
Excellent.
So-
Christy, thank you so much. So people can go to your website,
Yes.
Quincy College, and you have one in Quincy and in here in Plymouth, and it's only Plymouth that has this program?
Yes.
Okay.
Yep, we're
So you
housed in
visit
Plymouth.
the Plymouth campus for this
Correct.
PTA program.
Mm-hmm.
Thank you so much for joining us
Thank
today.
you.
And you take care.
Okay, you too.
If you've enjoyed this video by the local scene, please give it a thumbs up and hit the subscribe button. Thank you for watching.